Hello, dear listeners. Welcome to CareSmartz360 On Air. I'm Dennis Gill, a senior sales consultant at CareSmartz. Today, we are honored to welcome Chris Gerardi, retired president of Home Helpers and Direct Link certified Alzheimer's educator. With decades of experience leading mission-driven care, Chris has witnessed firsthand how home care has transformed from emerging support service to a central pillar of patient-centric healthcare. So, from demographic shifts and tech innovation to caregiving challenges ahead, Chris will share invaluable insights for agencies navigating the future of care. Welcome to the podcast, Chris.
Thank you very much, Dennis. I appreciate the opportunity to be here.
No, we're really glad that you were able to take out the time today for our listeners, and we really hope, and I'm pretty sure that this will be a pretty fruitful session for all of the listeners.
I'm looking forward to it.
Okay, perfect. So without wasting any time, I'll straight away jump in with my first question for you. So looking back, Chris, how has the home care industry evolved, and what hard-earned lessons still hold true for agencies today?
Well, that's a really good question. And, I would start off by saying there's been an enormous evolution on many parts, but I'd say really the three key areas have been the level of competition. To give an example, in Illinois, when I started in the demographic area that I was working, I maybe had 10 competitors. And by the time I left the business 15 years later, there were over 100. Oh. And so there's an expansion and in competition, not just with caregiving agencies, but with home health agencies providing caregiving, and also in some cases facilities moving out to help people as well. Another one has been technology.
Got it.
In terms of both operational efficiencies and measuring metrics, and in terms of marketing. So, on the operations side, there's much more capabilities, particularly with some AI involved now, in terms of scheduling and communications with caregivers and measuring customer outcomes. And on the marketing side, the whole use of internet and social media, of course, from when I started in 2009, has expanded and accelerated. And you have many more ways to reach out to people and recruit. And the final one would be training resources. There's many more opportunities now to look for training for caregivers, both in-house and online.
Oh, okay. Good to know about that. And from your experience, what are the biggest barriers to sustainable growth today, especially when it comes to caregiver recruitment, retention, and operational stability?
Well, in terms of recruitment, it certainly goes back to my mention of competition. Okay, so you have to be able to separate yourself in terms of gaining ground in the recruitment world, and where you're looking for caregivers. I think there should be non-traditional ways considered versus just the typical job boards. An example meaning recruiting on core values and considering training up people who maybe didn't think about being a caregiver, but they have those core values and they want to help people, and you train them to be able to go in the home. And then there's the retention value that is a big barrier. When I started the business, maybe 25, 30% turnover. Now, and it's recorded, there's 75 to 80% turnover with caregivers. So once you get a good caregiver, you have to hold on to them. And how do you do that? I think it's not with how much you pay them necessarily. That's important, but it's more about how you treat them. Treat them equally to their clients, treat them with respect and dignity, be open and honest with them about your business. Help them through their issues, and keep them on board for as long as possible.
Correct. Definitely caregiver retention, as I've had a few sessions with other personalities from the home care industry side. So caregiver retention, I've seen always is the biggest point that everybody discusses. That should be there.
Absolutely. Yeah, absolutely. A big challenge, but it's doable if you're creative about how you do it. Try not to do the same way everybody else and just go to those job boards and try and fill up your pipeline that way.
Got it. And what key performance metrics should agency owners focus on to truly understand what's working and what's holding them back? Both the things.
I think the few areas here Primarily quality. You
Mm-hmm.
have to be able to measure and prove your quality. You can't just say you're a great caregiving agency because of how large you are or
Yeah.
the time you've been in business. You've got to have metrics that prove to a potential client family that you've got a great reputation.
Mm-hmm.
And there's ways to do that through benchmarking. There's organizations out there that do nationwide benchmarking along with regional benchmarking to
Got it.
know how you stand up against others in terms of quality. And they're getting feedback directly from your clients and from your caregivers to allow you to make adjustments and improve that quality. I think the other metric would be to be measuring customer outcomes.
Mm-hmm.
Super important, particularly if you want referrals from medical industry. They want to know that you're keeping people from being readmitted to hospitals and
Got it.
living a longer quality life in their home where they're not necessarily needing medical care, because on a non-medical basis, you've covered all the bases with them and
Mm-hmm.
keeping them healthy and happy. And then there, client and you have to understand your lead sources and what's producing your caregivers and your clients. Okay, where are you getting that information from to expand your opportunities? Is it just through the typical ways, or are you using creative ways
Okay.
to stay in touch with clients and nurture that? Because ultimately, it's word of mouth that should be your biggest marketing source. Satisfied clients and their families, and not just after you've moved on from them, stay in touch with them and
Yeah.
continue to reap benefits of their feelings about your company.
Yeah. Good to know about that too. And just continuing with this question, that how important is marketing positioning today? And what should agencies evaluate then when choosing the right geography or zones for profitability and growth?
That's a great question, because this is super important, and I went through this myself
Mm-hmm.
when I acquired my franchise.
Okay.
And it's going to be dependent on where you are in the country.
Got
So
it.
it's not the same in every state, and sometimes in every county, because in some states you might be able to use public aid like Medicaid or even Medicare Advantage.
Got
But
it.
in other states, those aren't going to be profitable sources of business. So you've got to concentrate on private pay or veteran care. And so you've got to be looking at things like, what is the 65 population area, the population in your area? Are there
Mm-hmm.
enough seniors in the demographic you have to be
Okay.
clients? What are their median incomes? Is there enough private pay money in your area? Are people retiring in the community you're servicing? Because if they're retiring
Yeah.
and going somewhere else, you're losing that customer base. So you need to look at all these things, and as well as the kind of veterans. And at the same thing, you need to be looking at, is there a way that you can get Medicaid reimbursement in your state? Because some states are very good at reimbursing at
Mm-hmm.
a profitable rate. So you need to
Okay.
understand, are you going to be private pay or public pay or some combination? I wouldn't say you ever should have all your eggs in one basket, though.
Yeah. So all the things should be covered at that. Private pay,
Right.
VA, we have insurance. All right. All the
Correct.
things should be covered at that.
Yes.
And Chris, as demand rises in 2026 and beyond, how can agencies scale without compromising care quality, client satisfaction, and the caregiver experience?
Well, there's a few opportunities. The most obvious is technology. With AI, that is changing everywhere. I know that CareSmartz is utilizing that and expanding those opportunities and talking about it, because it can create efficiencies that allow you to scale by not necessarily adding staff. That was the biggest dilemma back when I had my business: is when do
Mm,
you hire that extra scheduler? When do you hire that extra case manager? And now you have opportunities to supplement their workload with AI, and you should be taking advantage of that. Not to replace people, but to scale. Okay,
scale up.
you should consider broadening your services. Things like having a partnership where you can bring a med reminder system into the home, or a fall alert system, or camera system that doesn't necessarily always need a hands-on caregiver. You have
Yeah.
some technology to support the family. I would also then add things like very creative and scheduling. Consider even flexible scheduling. Something that we tried successfully was to not let the client necessarily dictate the schedule, but to
Mhm.
identify the best caregiver and then collaborate with the family to get
Yeah.
that right caregiver in the home with a schedule that works for everybody, both the
Mhm.
caregiver and the client.
Yeah, we do that in CareSmartz360. We have that option, like
Hmm.
finding a
Yep.
caregiver, an apt caregiver according to the
Yep.
availabilities, what skills and
Hmm.
requirements, all the things are matched. Yeah, it does help. It does help with that part.
Hmm.
And continuing with that, my last question would be again, as we were discussing about the same thing, that's AI. So where do you see AI and automation making the biggest real world impact in home care? And where should agencies be cautious?
Well, that's a really great question because everybody wants to jump into AI. And my
Yep.
initial advice is to don't necessarily be the first to test something, but be an
Mhm.
early adopter when you know something is being proven by a provider like CareSmartz or anyone else. So be an early adopter. I know that agencies are now already using it to do things like answer their phones and redirect calls and reach out to caregivers through a platform that's provided to them. AI is important to help you make those communications, not to depersonalize it, but to be more efficient at making communications. And I would also say look at ways of digitizing your paperwork so
Mhm.
you are not in a traditional filing system, so you can look at things and access information very quickly. Through digitized documents. And finally, I would say you want to eliminate paper and move to systems. Process is super important.
Yeah,
I mean, it's 80% of your problem in any good company is not the people, it's the system. So you
system. Yeah.
really need to be open to using ways that are creating efficiencies, and in some cases helping you retain great people because they're not overburdened with some of the mundane activities that can be done by AI.
Got it. Got your point. Got your point. And now I was, thank you, Chris. It was
Mhm.
a very valuable session. I would think for all our listeners from all over the world, wherever they're listening our session today. And it was really, really great talking to you today. I know it was a small session. Definitely we would have loved to have another session with you, but much longer one. But this was a
Sure.
small, crisp session that we had with you today. And I hope it does help our listeners.
Well, thank you very much, and I appreciate the opportunity to contribute.
No problem, no problem. Thank you for your time, and thank you to my listeners today. So I'm Dennis Gale signing off today, and I'll be shortly back with you guys. So.